Okay, we're going to be talking about Chapter 9 today, Companion Animal Nutrition. There's going to be a lot of information in this chapter. I want you to focus on the key terms, macronutrients versus micronutrients, some building blocks, how things are broken apart, and how we look at all of the different things to decide, make a good decision about nutrition. We're going to talk about what the requirements are, and also what we see in commercial pet foods as well as home cooked, some different feeding protocols based on stages of life, and clinical nutrition as well. So what are macronutrients? Macronutrients are energy producers. Micronutrients are not energy producers. We use macronutrients to get energy, and they come in the form of proteins. Proteins are broken down into amino acids. Fats are broken down into triglycerides. Carbohydrates, which are broken down into simple sugars. Micronutrients are vitamins and minerals. This is a kind of a food pyramid, which shows at the very base the most important nutrient, to the top the least, I wouldn't say least important, but the ones that you need the least of. So you need mostly water in your diet, then carbohydrates, proteins, fats, finally minerals and vitamins. So water is the most important nutrient, delivers all other nutrients, helps with temperature regulation and the organ's shape and structure. Those are really important things. So delivering other nutrients, temperature regulation, and organ shape and structure. Proteins, protein structure they're made of long chains of amino acids held together by peptide bonds. There are multiple shapes and sizes, and they're made into complex molecules that from conjugation, so conjugating multiple molecules. There are two shapes. One is called a glycoprotein. This is protein that is conjugated with carbohydrates. And if you look on the right-hand side, this is an example of a glycoprotein structure. And then lipoproteins are proteins that are conjugated with lipids or fats. Lipoproteins, this is an example of a cell, actually, in a lipoprotein. So within this, we have a phospholipid monolayer, we have a receptor, we have free cholesterol, cholesterol esters, and triglycerols in there. Proteins, what do? They are the structural component of organs and tissues. They can also function as enzymes, hormones, and transporters, and they are a source of energy. Now, proteins are not stored in the body, so they are an important part of your daily diet. There are different biological values of protein, and all proteins are not of equal worth. Proteins are different whether they're meat proteins, proteins that come from meat or animal sources versus vegetable proteins. You need to have kind of a proportion between those two for growth and maintenance, normal body systems, and that proportion that you use for the growth and maintenance of normal body systems is a measure of its biologic values. So we need to remember the two different animal proteins versus plant proteins, but we also have to remember, I have this picture of the boot here, and this is to make a statement. This boot is also considered having protein in it. It has leather, it's a leather boot, and so there is protein within that leather. But what is the old boot? It's not as high protein value as, say, some egg or a piece of meat. It's not even as high a value as some of the protein that you find in vegetables. However, this is a source of protein, and there are some animal food manufacturers that can use a number of different sources of protein, potentially even including old boots, that then they say this contains this amount of protein. But is that good protein or is it poor protein? And this is where you start to critically look at nutrition to tell you or poor nutrition. Dietary protein is added to most commercial pet foods. Within the protein, we need a correct balance of amino acid composition. So when we have that correct balance, it helps us to classify protein that's high in biologic value. The greater the protein quality, the less is needed. And digestibility is a huge factor. So I've got this boot picture here again. Obviously, this is a low quality protein with poor digestibility. Fats and lipids provide and store energy, and they make up cell membranes. They act as signaling agents and hormones. There are some fats that are known as essential fatty acids. Anything that's like an essential amino acid or an essential fatty acid means that the animal or yourself must get it from the diet. So cats, for instance, need to have linoleic, alpha-linoleic, and arachidonic acid in their diet. That's essential. Cats also need taurine in their diet, and because that's an important part of how their heart functions, heart muscle functions. So that's something we'll come across later, but we need to have these essential fatty acids in the diet in order for it to provide what the cat needs. For dogs, they just need linoleic and alpha-linoleic acid. So what is a fatty acid? Well, there are a couple of different types of fatty acid. There are saturated, monosaturated, and polysaturated fatty acids, and then there are unsaturated fatty acids. A saturated fatty acid means there are no double bonds in the primary hydrocarbon chain. This is a double bond. This is a double bond. Okay, so saturated means all of the bonds to the carbon are filled with a hydrocarbon. There's no space for a double bond anywhere. A monosaturated is where you have one fatty acid with one double bond, and polysaturated is a fatty acid with more than one double bond. When you have double bonds or no double bonds, it just tells you how easily things can be transferred from the fatty acid and back. So there are sometimes when we need saturated fatty acids in our body, but a lot of times when we need non-saturated fatty acids. So this is a triglyceride. This is a picture of a triglyceride, which is also called a basic neutral fat. It has a glycerol backbone with 3 fatty acids attached. Carbohydrates provide energy and building blocks for other nutrients. They include simple sugars like glucose, sucrose, and fructose, and complex sugars, which are starches, glycogen, and some fibers. These are digested to glucose and other molecules. With excess glucose, if you have excess glucose, you take too much sugar in your diet, it's stored as glycogen, which then can be converted to fat for long-term storage. Fiber is often classified as a carbohydrate, but it is not broken down into sugars. So fiber is in the carbohydrates, but it's not really. It's not broken down into sugars. So it's technically not a nutrient, but it has a positive effect on health. It resists digestion, so it helps to move things through the digestive tract. Mostly found in plant sources, and we have soluble fibers and insoluble fibers. Soluble means that they can be dissolved with water. Insoluble means that they can't, and it's important to have both of those. So navy beans, we have this is just something I have a graphic representation of some fibrous plants: lettuce, asparagus, navy beans, brown rice, and oatmeal. And these numbers just tell us what Americans think that are a good source of fiber. So 75% of people do think that oatmeal is a good source of fiber, and they're correct. They're rich sources of soluble fiber. Only 60% of people think that navy beans are a good source of fiber, and actually they are a good source of fiber. So these are lettuce, asparagus, and brown rice have fiber in them, but they're not as rich in fiber. Vitamins, functions, and sources. Vitamins are used in metabolic processes. They prevent deficiency syndromes. They're found in animal and plant tissues, but some can actually be synthesized in a chemical lab. There are requirements that different species have. We do need to remember the vitamin classifications because we can overdose or underdose based on the classifications. Vitamins that are considered fat soluble are vitamins A, D, E, and K, or ADEC. These are stored within fat because they're fat soluble, and so they can accumulate in body tissues. Because they can accumulate in body tissues and are released at different times, we can overdose with vitamins A, D, E, or K, or ADEC. If we take too much of it, we can actually cause a problem with our bodies. The water-soluble vitamins are B and C, so it's very difficult to overdose on vitamins B and C. And that is because we excrete them rapidly through our urinary tract system. So whatever we take in, typically what we don't use, we're going to urinate out. So that's your vitamins. And again, it's important to remember what's fat soluble versus what's water soluble. For minerals, these are used in metabolic processes and provide structure. So for example, calcium is a mineral and it provides structure in bone. There are some inorganic elements that can be used as within food as a source of mineral. This is often called ash, and you may see this in the ingredient list of an animal food, or even in some cases human food. These are burnt cartilage and bones, and they do provide minerals for the animal. Minerals can be difficult to classify because they have many different functions in the body. There are macrominerals, which are required in larger amounts, and microminerals, which are required in smaller amounts. Some examples, I'll give you some examples real quick of some macrominerals. Calcium, sodium, potassium, chloride. Those are all macrominerals. And if you think of those, and if you've ever worked within a hospital or in a clinic, you may know those as electrolytes. Microminerals are things like selenium, manganese, little bits of minerals that our body does use in metabolic functions, but just in smaller amounts in the body. Some supplements you might find that are helpful for the body. Antioxidants. If you've done any reading or watching of TV lately, you will see that antioxidants touted as being really important. Well, they are, because what happens as cells age is they actually oxidize, and anything that is an antioxidant keeps cells from aging. So they keep cells healthier longer. So antioxidants are a very important supplement. Carotenoids, choline, and L-carnitine are also some vitamins and some supplements that can be really helpful with the body functioning. When we're talking about nutrition, we often have to talk about it in terms of energy units. What kind of energy do these fats, proteins, and carbohydrates provide for the pet? Kilocalorie is a way that we talk about it. Now, we usually are talking about calories. And so instead of saying, how many calories did you eat today, you should be saying, how many kilocalories did you eat today? But that's not how we think about it. 1 kilocalorie actually equals 1,000 calories. A calorie is defined as the energy needed to increase the temperature of 1 gram of water, so a measurable amount of water, 1 degree, from 14.5 degrees Celsius to 15.5 degrees Celsius. So 1 gram of water, 1 degree, and we can measure that. Now when we measure it, we measure the calories in terms of kilocalories, and then we talk about those. A kilojoule is the energy needed to move a 1 kilogram weight 1 meter by 1 Newton. So it's a measure of work instead of heat. So sometimes you'll find energy of food or energy provided in kilojoules, but typically when we're talking about nutrition, we're measuring in calories, or actually typically in kilocalories. When we're talking about energy partitioning, this is how do we measure energy precisely? Like, how is energy used within the body. So the gross energy is like looking at a bowl of food and making a guess as to the potential of the energy that food or diet is going to provide for the animal. So it's a bowl of food. Gross energy is I'm looking at the bowl of food. Hey, it looks like a fair amount of food. It looks pretty nutritious. It's going to provide this much energy. Digestible energy is the amount of food that's actually digested by the body. And we can measure that based on how much feces is produced by the animal. So what is that bowl of food, that gross energy, minus the amount of feces, the volume of the feces? That is your digestible energy. And you'll find that the more waste you have, the more feces you have, the less energy is actually in that bowl of food. So foods that are more cheaply made, maybe grocery type foods, Alpo, Olroy, things like that, they're a little bit more cheaply made. They're a little bit cheaper to buy. You'll find that pets on that diet will defecate a lot more. So my pets are on a little bit higher energy diet, more digestible energy, and so they may defecate once, maybe twice a day, but usually just once a day. It's a lot less waste, and that's what you're looking for when you're looking for good nutrition. So digestible energy is gross energy, or the bowl of food, minus fecal energy. Metabolizable energy really kind of dials down a little bit more and measures the digestible energy, which is the food minus the feces, and then subtracts how much energy is lost in urine and body gases. This is the most common energy on pet foods, on companion animal foods. So metabolizable energy, they've done some testing, or should have done some testing, on animals, measuring the amount of fluids that are released, the amount of feces that are released, and the amount of gas that is released from their body after they eat the food. Net energy is dialing it down even further from metabolizable energy minus the energy that's used for digestion. So further studies are needed in order to get that net energy. There's something called Atwater factors. It's an estimate of energy content used by commercial pet food products. And what it does is it assigns an energy or caloric content to the 3 macronutrients on a metabolizable energy basis. So Atwater factors are published numbers that will assign energy to where the proteins, the fats, and the carbohydrates, and what types of proteins, fats, and carbohydrates, so that companies can more easily have an answer to what is the metabolizable energy of these ingredients within the food. Energy density is the kilocalories per unit of food, ingredient, or of the pet food. And it's usually expressed as kilocalorie per kilogram of food. Typically with dry dog foods, it's 3,500 kilocalories per kilogram. And with dry cat foods, it's 4,000 kilocalories per kilogram. So more calories in cat food than in dog food. Energy expenditure is the energy being used or burned. Resting energy requirement is the energy for a normal animal at rest. The metabolizable energy requirement, or MER, is the maintenance energy requirement. It's also called the daily energy requirement. You can calculate a resting energy requirement and then estimate the metabolizable energy requirement using some multiplication factors. Now I have for you an assignment within the Dropbox. There's an assignment that tells you exactly what to do and how to do that for your pet. And what you're going to need to do is either using your own pet or a family member's pet, or somebody if they have a pet, you want to take that pet's weight, also estimate its body condition score, and I'm giving you information about that as well. And you're going to do a real quick mathematical calculation. Doesn't take very long, and I've given you all the tools you need to do it, and decide, are you feeding too much or too little based on those factors. Protein dietary requirements. Nitrogen is a requirement of food, and it's it's part of amino acids, and we have within amino acids we have essential, which are indispensable. We cannot make them within our body, and so we need to have them in our diet. There's also non-essential, we call dispensable. They're formed in the body, so we can get them in our diet, or our body will make them itself. And there's conditional essential, so it's required in the diet during certain diseases or life stages. And so it's important that we are able to be aware of what those conditionally essential is, so we can provide those in the diet as needed. Protein dietary percentages. There are 3 methods of measure of protein. As fed means it's coming directly from the container. Dry matter means they've taken it and they've removed all water and moisture, and have developed an understanding how much protein is in there without the water or moisture in it. Metabolizable energy basis is the protein, fat, and carbohydrate measures only. There is no minimum protein requirement for animals, but we have an amino acid and nitrogen minimum. My question is, should there be a maximum protein requirement? And my answer to that would be, in most cases, yes. Most animals need about 18 to 23% protein in their diet to function normally, for their kidneys to function normally and not be overwhelmed with protein and having to digest it, and their liver having to metabolize this protein. So to 26%, depending on the energy of the animal. We are seeing foods out there that are saying the more protein the better, and more of a good thing isn't necessarily a good thing. So when protein, that actually may be too taxing on the liver or the kidneys for that particular animal. So we do want to be real careful with that. Protein quality does make a difference. We talked about that old dry boot, right? Calculation is whether the amino acids are suitable and in a digestible or usable form. Digestibility, we need to remember that plant-based proteins are a little less digestible than animal-based proteins. There is protein in corn, and it's not necessarily a bad thing for corn to be the first thing on the ingredient list. When they do an ingredient list, it's based on what's most prevalent in the diet. If corn is the first thing on there, that's a big marketing thing that people have said, well, if corn's the first thing, that's the worst thing. It's not necessarily, because corn does have fiber in it, carbohydrates, and protein. But if they have corn, and then corn meal, and then corn flour, and then corn starch, that's what we call ingredient splitting, and that can be a bad thing. So we have to be really careful of that, because some companies will list chicken as their first ingredient, which is terrific. However, they'll then split the corn into different forms, so they're actually getting more corn in the diet. They're just ingredient splitting it so that it looks like it's less. So we have to keep those things in mind as well. Fat structure. There are short chain fatty acids, which are building blocks for structure. Medium chain triglycerides, which are pretty healthy. They're found in mother's milk, coconut oil, but they are a little less palatable than the long chain triglycerides. Long chain triglycerides are most common, and they do contain linoleic, alpha linoleic, and arachidonic acid. So those are pretty important. Remember, saturated fats mean no double bonds, and that's commonly found in animal fat. And they're not necessarily bad, but they need to be taken in smaller amounts than polyunsaturated fats. Monounsaturated fats are one double bond, and polyunsaturated fats are 2 or more double bonds. The more increased saturation, the more you have a solid fat going to a liquid. So we're looking at increased saturation means we have a liquid fat versus a solid fat. Omega-3, omega-6, and omega-9 are polyunsaturated fats, and they tend to be excellent antioxidants, especially the omega-6s. Both fat and essential fatty acids are required for cats and dogs. We just have to be really careful about excessive intake, because that can lead to an obese state. Carbohydrate daily requirements, there is no minimum. Carbohydrates do supply energy, but they are not the primary source of energy for meat eaters. They do convert glucose to fat for storage, so we do have to be careful about that. They do help to supply body heat and structure for other nutrients. Fiber are complex carbohydrates. They're not typically digestible in the stomach or small intestine. There are some water-soluble versus insoluble. They increase water in fecal bulk to help regulate bowel function, so it's super important that we have that. May increase fiber in certain instances, like animals with diabetes or overweight animals, to help remove things from their intestines. Vitamins, these are organic compounds necessary for normal physiologic function. If you're not eating your veggies, you're not getting your vitamins, and your body will not function well. Vitamins are classified into fat-soluble and water-soluble. Remember, fat-soluble is ADEC, and they are stored in the fat, so it's important to remember that. They can be overdosed. Water-soluble are B-complex vitamins and C. Some fat-soluble vitamins and what they do. So vitamin A is responsible for good skin, vision, growth, reproduction, and immunity. Carotenoids are a pro-vitamin A, so when you take carotenoids into your body can make it into vitamin A. Cats do need this as a dietary source. They need animal protein. Vitamin D is regulates calcium absorption and mobilization. It's also known as calcitriol or cholecalciferol. We do need vitamin D in the body. Vitamin E is known as tocol or tocotrienol. It has a lot of antioxidant activity. Vitamin K, it can be dietary or synthesized, and it's vital for blood clotting. B-complex vitamins, there are a lot of different B vitamins. Thiamine is B1, and it helps with metabolic reactions. It's not stored in the body, so we need to get it through supplements. Cats are more susceptible to deficiencies, so we need to make sure it's in their nutrition. Riboflavin, B2, helps with biochemical reactions and energy metabolism. Niacin is B3, and it helps with metabolic processes. Dogs can synthesize niacin, but cats need a dietary source of niacin. Pyridoxine, B6, helps with enzymatic reactions. Cobalamin, which is B12, is synthesized by microorganisms, so bacteria that lives in the guts, and it comes from animal sources only. There's a couple other vitamins we'll talk about. Pantothenic acid, important for energy metabolism. Folic acid is a cofactor in many metabolic reactions, particularly in the GI tract. We absolutely have to have folic acid in order to digest things. Biotin, again, another cofactor in reactions. Choline, which is synthesized in the liver, helps with metabolic reaction. And then finally, vitamin C, which is known as ascorbic acid. It's not needed in a dog or cat diet, but it's a cofactor in reactions, and it's an antioxidant, and it's something that can be helpful in a dog and cat diet. It is, vitamin C, by the way, essential in a guinea pig diet. Guinea pigs must get vitamin C every single day of their life, and it's got to be fresh vitamin C. So we often recommend strawberries, oranges, carrots as a source of a daily vitamin C in a guinea pig diet. Otherwise, they get scurvy. Mineral dietary requirements. So what minerals do they need? There are 12 essential minerals for dogs and cats. And what does essential mean? It means it must be in their diet. There are macrominerals versus microminerals. Macrominerals are ones that are measured in grams. Those are things that we need in larger amounts in the body. So calcium, phosphorus, magnesium, sodium, potassium, and chloride. We often call these electrolytes. These are things that we measure in the blood. Microminerals or trace minerals are things that we need in smaller amounts in the body. Iron, copper, zinc, manganese, selenium, and iodine. These are things that we need for red blood cells to function, for our thyroid to function, for a number of different things in the body. So let's talk about commercial pet food. Dogs are omnivores. You have seen a commercial, I'm not going to say who it's by, but they state clearly that your dog is a carnivore. That is not true. Dogs are omnivores. They can do well on both an animal meat-based or plant-based food. They can live as a vegetarian if they are given the correct protein amino acid balance. Cats, on the other hand, are obligate carnivores. Their diet must be animal-based, although you can use some grains and starches and vegetables as well. But you cannot substitute the meat at all. There are a lot of different types of commercial pet food. Most dog and cat foods are complete and balanced and are available in dry and wet canned varieties. So any dog food or cat food that you find, they are at least regulated to the point that they should be complete and balanced. But the question is, for whom are they complete and balanced? And the answer to that is they are complete and balanced for the high energy young animal. So the ones that are the most energy needs, that's what they're complete and balanced for. So when it says complete and balanced for all life stages, what it means is complete and balanced for a puppy. So we have to remember that, okay? So when you're looking at pet food brands and different things available, when you see all stages, you have to remember what they're feeding to is the animal that needs the most energy and the most nutrients, and not all animals do well with that, and not all animals can live on that. Both dry and wet processed foods from reputable companies contain adequate nutrients. So if you have it says complete and balanced, you do not need to add any nutrients or vitamins. You do not need to supplement anything in order for them to maintain life. If you are experiencing an animal with a disease process or some sort of injury, at that point you may need to supplement. But if it says complete and balanced, no added nutrients or vitamins are actually necessary. There are a lot of pet foods out there, and it's really hard to know what is the best thing to feed your pet. So you need to understand that these pet foods are marketed, and they're marketed to you by people who don't necessarily understand nutrition. So I'm going to explain what the labels might say on the pet food and what it actually means. All purpose means that it will feed healthy animals of any age or lifestyle. But again, if it's all purpose, it is going to feed the one that needs the most energy. So really, really high energy dog or young dog or puppy that has high energy needs. There are specific purpose dog foods that are scientifically proven to help with certain life stages. So large breed puppy, adult, senior. Those are specific purpose. There are considered value foods, and these are based on the price, okay? Premium doesn't mean anything except that it claims that more expensive ingredients and healthier. So it claims that, but it doesn't necessarily mean the animals that's best for this particular animal's nutrition. There are a lot of people food products. Food is designed to look like recognizable human food, and you got to think who they are marketing to on that one. They're marketing to humans. Is this food product really best for the animal? It might be, it may not be. You have to use critical thinking techniques in order to discover that. Flavors and varieties, again, who are they marketing to? The person who's opening up their wallet. So distinct flavor varieties, you may decide that your cat likes fish. They may actually like fish, and so that's all you get is you get the fish flavor varieties. But it's a human marketing technique. It's not specifically based on nutrition. There may be special ingredients or nutrients. It may say natural, organic, or holistic. Those words mean absolutely nothing in terms of nutrition. Nothing. It just means that they have, if it says organic, it may mean, if it's certified, or if it says certified organic, it may mean that it comes from all of the sources of the food come from an organic farm, something that doesn't use pesticides, antibiotics, etc. If it says organic and it isn't certified organic, it means that it comes from organic food sources, which means any cow, any plant, anywhere. Natural means nothing. Holistic means nothing. It just means something, it grabs a hold of our human sensibilities and it markets to us. Raw food is something completely different. We'll talk about that later. The biggest push these days has been for grain-free diets. And if you've been paying any attention at all, you'll know that grain-free diets are not the best thing for every pet. There have been many pets that have died recently from grain-free diets because it's not actually providing all the nutrients that they need. So there's a movement away from grain-free diets in order to provide the proper nutrition. There are also veterinary therapeutic diets. These are typically by prescription, bought at a veterinary hospital or with a prescription from a veterinarian. They're not medicated diets. They're diets that contain specific nutrients and supplements that are not found in over-the-counter diets. So it could be urinary acidifiers or special fiber mixtures, extra antioxidants, extra omega fatty acids, those kind of things that you find in veterinary therapeutic diets. Could be that the proteins are broken down into individual amino acids. We call this hydrolyzed proteins, so that the animal doesn't develop an allergy to the protein. Veterinary therapeutic diets can be more expensive, but the reason they're more expensive is that there's a lot more scientific research that goes into them, and the nutrients are much more, they're much better product, and they're checked over much more frequently. So when we talk about regulation, there are 5 different regulators of pet food, and they kind of hit at different points within the food manufacturing. FDA, or the Canadian Veterinary Practice, the USDA, AFCO, which is the animal food, NRC, which is a national or nutritional council, and then FTC. And I'll go over these individually. It's not hugely regulated, but it is monitored at a certain level. Every pet food should have an AFCO stamp of approval on it that says it meets the minimum requirements. What you have to realize is that many of these pet foods, it doesn't matter who is making them, what name is on the bag of food, many of these pet foods are actually manufactured at the same plants as another type of pet food. And so these pet foods are manufactured specifically, they may have a specific brand name on it, but it may be manufactured at the same factory as another one. So if one has a bad run of food, another one of a different brand may have a bad run of food as well. So some of the things that we can see in factories are salmonella contamination, listeria contamination, and they can contaminate a number of different foods. So they do have recalls, and it is important to keep an eye on those recalls. And if you see a recall in another type of brand of food as well. The other thing to realize is that the more expensive the brand of food, the more likely they are to be checking multiple batches of food for any type of contamination or problem with the food. And so that's an important thing to remember as well. When you're paying for more expensive food, it's typically because there's more scientific research going into it, and they're checking the batches more frequently. So that's important. Pet food label. So what are we looking for when we're looking at a pet food label? Nutrition label. This is along the same lines. So first of all, you're going to see a principal display panel and then an information panel. There's a guaranteed analysis, which tells you exactly what is in it. An ingredient statement, which tells you all the separate ingredients in it, and again, they're listed from the most the quantity based on quantity of the ingredients. There are feeding directions. And remember, when they're talking about feeding this food, what are they trying to sell? They're trying to sell an amount of food. So they are going to say to feed to the highest energy needs of the pet. So they're basically trying to sell food. So you do want to be real careful with how much food you're actually feeding. Statement of nutritional adequacy and I'm sorry, I have feeding directions on there twice. They will also have the product identity and the net weight of the food. So here's an example of a pet food label, just a generic label. We have the brand name, the product designator, so it's dog food. Your nutritional claim, complete and balanced. So what does the complete and balanced mean? You do not need to supplement with anything else. Your net weight, how big is this? Ingredients. Water is the first ingredient. It's usually going to be the first ingredient in any canned food. Liver, chicken, corn flour, and then we have further smaller ingredients. You can see zinc oxide, potassium chloride, so our macro and micro minerals. We have vitamin E, thiamine, niacin, calcium pantothenate. We have folic acid, biotin, vitamin B12 supplements. So we have our vitamins in there. Here is your guaranteed analysis. Crude protein, crude fat, crude fiber, so protein, fat, and fiber, how much percentage, and it just gives you a minimum. You have minimum 8.5% protein. Here is your moisture, 78% moisture in a canned food. That's fairly normal. Ash, remember ash contains some minerals and a little bit of bulking insoluble fiber. Calcium, phosphorus, taurine, and magnesium. This is who made the product and their address. And here's your AFCO statement. This is a nutrition adequacy statement. This doesn't mean this is great food. It just means it's adequate. This product supplies complete and balanced nutrition for the maintenance of adult dogs. Your feeding guidelines, it says 1 can per 10 pounds of body weight. 15-ounce can per 10 pounds. It doesn't tell you how many times a day, does it? That's a lot of food for a 10-pound dog. And so we have to keep that in mind as we are thinking about this. Now, one thing I don't see on this is how many kilocalories this pet food contains, and that would be something that I would want to see. This is required information, but I'd also want to see the kilocalories per can of food. Now, a home-prepared pet food. This may be something that you want to suggest to a client who is trying to include specific ingredients that they can't find in a manufactured food, or they want to avoid specific ingredients because of the health of their pet. So it does decrease the amount of chemicals, preservatives, additives, and byproducts that you might see in many of the pet foods, or somebody might think that pet foods aren't manufactured in the best way. There are good pet foods out there that do not have chemicals, preservatives, or additives or byproducts in them, and you can find them. But some people would prefer to do home-prepared pet foods. So they're trying to avoid contaminants and toxins. They want to make sure their pet is as healthy as possible. Their pet may have a food allergy or intolerance. They may not eat manufactured food very well. It could be a cost thing, but it certainly will increase the human-animal bond. So we have to keep that in mind, and this is why people want to do it. There are risks when you use a home-prepared diet. Most commercial pet foods are superior in nutrient content, convenience, cost, and overall quality. It is a lot easier to feed a good quality commercial pet food. Published home-cooked pet food recipes are generally imbalanced, and they can be further imbalanced if the person isn't paying attention to a specific recipe or isn't doing it daily in the same way. Energy and nutrient requirements are not linear. Long-term use of home-cooked pet food can often result in nutrient deficiencies or excesses. There are safety concerns as well. If you're feeding a raw diet, there are some toxic natural ingredients that you have to be very careful of. That if they're not cooked properly or not cooked at all, can be a problem. There are also some pretty vague recipes out there, which means you're getting imprecise measurements. If you're not using a gram scale when you're preparing a home-prepared diet, you're not doing it correctly. It is possible to achieve the same nutrient balance with a home-cooked food as with commercially prepared food. However, most owners are not capable. Consult with a veterinarian or preferably a board-certified veterinary nutritionist to obtain a balanced recipe. And you'll find nutritionists mostly at universities or specialty practices. Owner compliance should be well regulated. We should be in contact with them frequently and make sure they're doing okay. And diet should be kept in conformity with animals' needs and life stage changes. I have had people who are very, very keen to do raw food diets and do it through all stages, and only to find out later that their geriatric dog is such a diet. Steps in formulating a home prepared diet and the reason the home diet is requested. You want to review the medical and diet history ranges for that animal at that time. You want to choose acceptable and palatable and safe ingredients. Enter chosen foods into a computer diet software for analysis to make sure that 100% of the requirements are met. You want to list the instructions very clearly, the measurements very clearly, and you want to be able to consult with veterinarians that have this, that are board certified nutritionists. As a technician, you're going to be evaluating the animal through a physical exam. We may want to see them maybe 4 times a year to make sure they're doing okay. Body weight, body condition score, and their activity level, and then again, consult a nutritionist. Okay, now we're going to shift over to feeding different stages, starting with neonatal dogs or baby puppies. Puppies nurse within a few hours. Is the first milk, and it contains a lot of antibodies and it has a lower milk sugar or lactose component level than milk, so they're going to be nursing a little bit more frequently earlier on. At about 24 hours postpartum, colostrum is going to change over to milk, and the protein content will halve. Lactose increases during week 1, so that's what colostrum is very, very important because it contains a passive immune system for those baby dogs that don't have an immune system yet. If you have orphan puppies they're unable to nurse adequately, you need to watch them very closely. You're going to assess them for signs of inadequate intake. They're going to be crying a lot more. They're going to be cold. Their belly's not going to be full, and they're obviously not going to be gaining weight. You want to choose a commercial milk replacer, and it's approximately 30 mils for every 115 grams of body weight divided into frequent feedings. So you want to mix that up just a little bit at a time because you don't want to store it for very long. It goes bad pretty quickly. You can feed via syringe, or you can use a feeding tube as long as you get it into the esophagus and not into the trachea. I don't want to put that food into the lungs. You'll kill them very quickly. Or you can use a small animal nursing bottle. To be very frank, to avoid aspiration pneumonia where they're actually ingesting or inhaling the milk, if you can do it properly with tube feeding, that's probably the safest way to do it. The stomach is full when the body is distended or the animal turns its head away from the bottle. New formula should be made at each feeding, and you want to keep the formula at room temperature before you administer it. If you administer cold formula, you're going to make the animal cold. At about 3 weeks of age, we're going to start to introduce a semi-solid gruel. So we're going to add to the milk, we're going to add a little bit of soft food, and they may start to lick at that a little bit. At about 4 weeks of age, we're going to start to add little crunchies into that milk. At about 5 to 6 weeks of age, the intake of mother's milk is going to be reduced, and you're going to have adequate amounts of solid food consumed, and we're going to start to remove puppies from mom. As far as weaning, mom's going to remove herself. If we can temporarily reduce mom's intake for about 2 to 3 days, so just reduce the amount of food, get it to a normal amount of food. When she's nursing, we're going to give her whatever she wants to eat, puppy food, for as long as she wants. So real high energy food at all times. At about 5 to 6 weeks of age, we're going to reduce that, so we're going to be able to reduce the milk that she's giving out and encourage the puppies to start to eat. Now we want to keep the puppies, for behavioral reasons, with mom until they're at least 8 weeks of age. From weaning to adulthood, as they're growing, they're until they're about 10 to 18 months, or until they're neutered or spayed, puppies are going to need 2 to 3 times as much energy as adults until about 50% of their adult weight is reached. And it really depends on the size of the breed. So smaller dogs are going to reach that 50% of adult weight at about 4 to 5 months, whereas larger breeds are not going to make that until about 10 to 18 months. Growing dogs need about 1.5 times the adult energy until about 80% to 100% of the adult weight. Now, when we say adult weight, I really mean adult size and body condition score. You can feed a puppy, a 6-month-old puppy, until it's 100 pounds, but that doesn't mean it's a good weight or an adult size. So needs of a growing dog are energy, protein, fat, calcium, and phosphorus for that bone growth and good cartilage maintenance. We do want to avoid unnecessary calcium supplements, however, because if you get that balance of calcium to phosphorus off, it's going to change the way that they grow and it's going to make things worse. You do want to teach your owners how to do a body condition score. If we keep puppies at a normal body condition score that's at a 3 out of 5 or at a 5 out of 9, 4.5 out of 9, if we keep a lean puppy, they're going to grow into a lean adult. If we have a puppy that's roly-poly and cute and fat, it's going to grow into an adult that has difficulty losing weight, and that can lead to long-term problems. Our primary objective with feeding adult dogs is to find that maintenance energy requirement and proper food dose to maintain ideal body composition, so your ideal body condition score. You can calculate your resting energy requirements in kilocalories per day and inform the owner that most dogs need only that amount or slightly more per day, depending on their energy level. You want to monitor for overweight conditions and overfeeding. Remember, overfeeding an animal is the same as underfeeding an animal. It's the same thing. If you underfeed an animal, people say, oh, you're neglecting that animal. Overfeeding an animal causes similar or even worse conditions in animals as well. So please keep that in mind. Feeding and gestation, and 80%, let me say 80% of our animals in this country are overweight. That means we don't have a good understanding of what a normal body condition score is. Gestation means they're going to be having a puppy or kitten. So remember, gestation for, we haven't learned this yet, but gestation for a dog or a cat is 63 days. That is 8 weeks, right? So at weeks 1 to 5, that's 2/3 of their pregnancy. Fetal growth is minimal. You don't need to make any nutrition stages. However, at week 5, you want to start increasing mother's intake by 30 to 60% and add approximately 26 calories per kilogram of body weight. This lasts for about 4 weeks, and fat intake. So that, and also increase some calcium. Generally what we do is we put them on a puppy food because that has the right amount to create puppies. Parturition is birthing, so most dogs 4 hours before whelping or having the puppies. Lactation, we want to give them as much food as possible and as much 4 or 5, and because their energies are going to be 2 to 4 times that of what they need when they're growing puppies. Feeding puppies is a lot harder than growing puppies. Working dogs might have a specific nutrient composition based on what kind of activity they're performing. Carbohydrates and fats help with energy, and if we have intense muscular exercise, we're going to need that. Carbohydrates will provide a short burst of energy. So if they're doing short bursts of energy, carbohydrates, fats are going to be longer bursts of energy. So endurance, animals need more fat. Adequate water intake is through work period is crucial. Geriatric dogs, toy and small size breed, they're considered geriatric, usually around 12 years of age, 10 to 12 years. Medium-sized dogs about 8 to 10 years, and large breed dogs looking at 6 to 8 years, or really 8 years. So geriatric or older breeds. Some changes we'll see in dogs. They're going to have a reduced energy, so reduced need for energy. Fat can be important in poor appetites because increased fat means increased palatability. It reduced food intake unless the dog is overweight. So we may need to add fat to the diet depending on their weight. And then obviously adjust fiber to fit the needs of the dog. Their nutrition is influenced by body condition and by their individual health history. We want to try to maintain an optimal weight because the less weight they have, the better it is for their joints. Healthy older animals unless we have a medical condition. We want to make modifications slowly over 1 to 4 weeks to allow for adaptation. Anytime we switch food from one food to another, we want to take several weeks to do that. Nursing for cats, they are going to suckle within a few hours of birth, just like puppies. Queens are going to have colostrum for first 24 hours, and then switches over to milk for over 72 hours. Kittens are going to nurse 6 to 8 weeks, but they're going to start to wean at about 3 to 4 weeks, completed by 6 to 9 weeks. It takes a little bit longer for their weaning. Adulthood at 10 to 12 months, their energy requirements is 2 to 3 times adult needs, and that will be provided for them in the type of food, not the amount of food, but the type of food. So kitten food has a whole lot more energy than adult food. Their protein needs are going to be highest at weaning, and we have to remember that kittens need linoleic acid. With cats, typically, because they all get to be about the same size, their typical energy needs with good food, excellent nutrition, would be 1/4 cup 2 times a day. And feeding meals for cats really helps us to understand if they're eating, and if they're not eating, we can find that out quickly, and how much they're eating, and making sure that they're remaining healthy. It also, if you have a cat that likes to go in and out, keeps them coming back twice a day, checking in. It helps you to monitor their health a lot easier. So we do recommend meal feedings for cats. We recommend 1/4 cup twice a day from kittenhood all the way up. Very rarely will they need more than that. Kittens that cannot nurse, we can do milk replacers. Now this is a puppy, but it's the same sort of idea. We can place a tube down into their esophagus. Once they get teeth, we may need to do it down into their nose. Orphans, it's about 15 mils for every 55 grams of body weight, so it's a lot less for little babies, divided into frequent feedings, and typically it's every couple of hours. Adult cats, they're considered adults 1 to 10 years. I do warn you, though, that once they are neutered or spayed, they tend to gain weight more rapidly. Their metabolism decreases, so you may have to decrease feeding at about the time, or switch over to an adult food at about the time they're neutered or spayed. Consistently want to feed 1 to 2 times a day. This eliminates overeating, finicky behavior, and food aversion. We want to avoid free choice feeding with cats. If you have indoor sedentary cats, they don't need anything more than resting energy requirement. If we have an animal that has hairballs or problems with weight, we can add fiber to their diet. Hydration strategies, we want to habituate cats to wet food because we'll often need it in old age. So giving them a small amount of wet food with their dry diet, it can help with maintaining hydration. It also really helps with urinary issues as well. In pregnancy, we need to start intake in nutrition at about 6 to 7 weeks versus 5 weeks for puppies or for dogs, just because they're a little bit smaller. We want to gradually increase 25 to 50% higher energy in the last 3 weeks of gestation, making sure they have plenty of calcium available. Free choice feeding and with growth or all stage diets, not a maintenance diet. So growth, kitten food, or all stage, which like I said is like kitten or puppy food, because it's feeding to the one with the most energy needs. During lactation, this is again the most demanding stage in all animals. They need most of their energy at 6 to 7 weeks postpartum, so they need to have free choice feeding all the time. And we're going to start to offer kittens moist food at 3 to 4 weeks. Older cats, they're not really considered geriatric until they're at least 10 years of age. Really depends on the health of the cat. Want to consider their overall health before making a diet selection. Monitor their food intake in association with weight changes, and if we have decreased appetite, if we can offer both dry and wet foods so that we can make sure they take as much as they need. Clinically, when we're working in a hospital environment, we have to really plan this carefully. These are dogs and cats that don't fall into a healthy category. So if we have an animal that's malnourished or sick, we need to do a nutritional assessment, get a complete medical and dietary history, do a complete examination, daily examinations and body weights for an assisted feeding program. When we're talking about assisted feeding, it means typically that we're forcing food into their system at some point. If we can get them to eat on their own, that's the safest. We're not going to create a point at which they may aspirate their food. Syringe feeding is rarely tolerated by sick animals because it can cause them to be aversive to that type of food that we want them to eat, and we increase the risk of aspiration pneumonia. Hand feeding is preferred to food drop-offs. So if we can have an owner come in and hand feed a sick pet, that's really helpful. If they are refusing a food, we want to remove that food after 15 to 30 minutes. If an animal is feeling sick and they smell food, it can cause them to be aversive to that food in the future. Nasoesophageal, NE, or nasogastric tubes. These are tubes that go through the nose, naso, the way into the stomach. They have a short-term usefulness, so we can use them for 1 to 3 weeks, but beyond 10 days, if we think we're going to need it for beyond 10 days, we want to consider a tube that's indwelling or something we can suture into place, like an esophagostomy tube, one that goes into a hole that we make into the esophagus through the neck, or something that goes directly into the stomach from the abdomen, the gastrostomy tube. Ostomy means the hole is made within there. A nasoesophageal tube can help to prevent gastric reflux. So we're not putting a tube through the valve into the stomach. We allow that valve to close so that we don't get gastric juices up into the esophagus. And it's actually more physiologic. It's more like feeding directly through the esophagus like it would normally be done. A nasogastric tube would go directly into the stomach and make sure the food gets directly into the stomach, but you can get some stomach aspiration with that. This is an example of an esophagostomy tube. This is a tube that is located in the neck of this animal. It is sutured or glued into place, and we will feed directly into that tube. It's for more long-term support, weeks to months. It can allow us to give a variety of diets, some slurries, kind of like milkshakey type food. The animal can still eat and drink voluntarily, so if they do decide to eat on their own, great, we'll allow them to eat on their own. Installation is it's a very quick installation. It's something that a general practitioner or veterinarian can do pretty easily. Make an incision into the skin and esophagus and go directly, put the tube in here. We go up through the mouth and then snake it back down, and we're able to feed from the side of the pet. Some complications from inserting this tube: vomiting, skin infection, premature dislodgement, so if we want to put an e-collar on this pet so he's not scratching it out, coughing, esophageal stricture, so that anytime we cut or damage the esophagus can scar down and become very small. That's called a stricture, and that can cause problems. A gastrostomy tube, this is an example of a gastrostomy tube in a pet. They have an e-collar on and a protective covering. It's going into the abdomen and directly into the stomach so that the animal can be fed directly to their stomach. This would be if we have to bypass the mouth and the esophagus for months to a year. We're wanting to monitor and make sure that they don't rip this out at any point. We can put tubes directly into the jejunum, called a jejunostomy tube or J tube. If we need surgical support, we would place this surgically. This would bypass the entire upper GI tract. We have to leave it in place for at least 5 days so we have adhesions, and we don't want to remove until we have normal voluntary feeding. So enteral feeding, anytime we place a feeding tube, it has an excellent method for supporting nutritional status. When we have a sick pet, they actually need more nutrition, and often sick pets don't feel like eating. So getting a tube in as quickly as possible to make sure we're getting them extra nutrition can be really helpful. We have to be very careful when we're introducing food through these tubes because we can induce hyperglycemia, too much sugars, hyperlipidemia, which is too much fat. We can also cause something called refeeding syndrome. When we introduce food too rapidly after they have not been eating, their body will not know what to do with the extra glucose, the extra fats, and it will cause them to go into this syndrome called refeeding syndrome, where we have decreased phosphorus, potassium, and magnesium that results in an intracellular shift when the food is introduced too quickly after a period of starvation. But what will happen is that it will actually kill the pet. So if we have an animal that has been starving for a long period of time, we need to slowly and gradually reintroduce food. So don't want to feed them a lot of food right away. Parenteral nutrition is when we're going outside the GI tract, beside para-enteral GI tract. So if we have an animal with diffuse intestinal disease, or they're at risk for aspirating, or we cannot sedate them, or they're in a stable condition, we don't have any fluid or electrolyte imbalances, they're able to tolerate IV fluids, but they have all of these conditions. We don't want to do it for less than 3 days. So once we start parenteral nutrition, we're going to be doing it for at least 3 days. Some examples, and I have a human here. We do this in animal medicine. It's done in a critical care unit typically, so you're not going to see it in a general practice, but it is something that you can do if you have a very sick patient. So our goal is to just supply our resting energy requirements. This may be this person looks comatose because we would be doing it in somebody who could not eat. We're going to place a long-term catheter, a central catheter. We're going to place it surgically. So typically we place it with animals into the jugular vein. We're going to leave it in for at least 3 days, probably longer, and then we need to prepare a very specific fluid called total parenteral nutrition, or TPN, that has certain nutrient precursors, some amino acids, micronutrients, etc., macronutrients, so we can just give and some glucose, so we can give just the amount of calories, etc., that they're going to need. And it takes a lot of math. You got to calculate the amount and the frequency, just like we were going to do if we were going to feed them. Monitoring, we're going to take serum, plasma, blood samples. We want to look for metabolic, septic, and mechanical complications when we're giving this TPN. This has to be given extremely aseptically, so without any bacteria introduced, because we're going directly into the center line. We could cause a serious blood infection. Partial or peripheral parenteral nutrition is when we can't get a central line available. We may have a peripheral vein, like a cephalic or a saphenous vein. We have to dilute our TPN into a partial peripheral nutrition. And we can only meet 50 to 70% of the RER needs, so we may have to do a nasogastric tube as well. We have to reduce it and our TPN over 8 to 12 hours instead of abruptly. For animals that are obese, which, as I said, is 80% of our cats and dogs in this country, it's the most common form of malnutrition. It is malnutrition. Results in overweight and obesity. First, we have to recognize that there is a problem, so you need to be able to talk to your client about body condition score. Then we want to take a thorough diet history, ask about activity level, exercise, and what kind of snacks they're also giving them. Are we feeding from the table? How many milk bones are they getting a day, etc. We want to estimate what their daily energy intake should be, and then select an appropriate diet to supply the nutrients within the context of the energy restriction. If we reduce the amount of food, it's a lot harder for the owner and the pet to comply. If we can reduce the calories in the food, that's a lot easier for them. Maintenance products have a moderate to high fat level, so if we can switch to reduced fat products for weight loss that still meets the nutritional needs but decreases the energy density, reduces the fat, it increases fiber, protein, and complex carbohydrates, so the animal is going to be able to eat the same amount of food and feel as full. So we're allowing that owner to consider offering or to continue offering reasonable amounts of food. Not all diets are all-purpose diets, but there are some that are. But if they're not maintenance or all-purpose diets, then we need to transition them off of a weight management diet once they've reached their goal weight. So that's our first option. If we want to term, we want to get one that is complete and balanced, that doesn't have any nutrient deficiencies or excesses. For exotic animal nutrition, a couple of questions just to get you thinking. I don't have a lot on this. We'll talk about those specifically when we talk about exotic animals. But for nutrition, these are the specific questions that I want you to be able to answer. Which species are seeds an appropriate diet? And my answer to you is that there are very few species for which seeds are an appropriate diet. The only ones would be seed-eating birds, which are finches, not parakeets, not cockatiels, and seeds are not as a sole dietary product, nutrient. Seeds are not appropriate for any mammal. Which pet needs hay daily to help with GI motility? That would be a rabbit, but a lot of, like chinchillas, guinea pigs, they also need high fiber, but a rabbit needs hay daily, and typically it's called Timothy hay, which is a type of grass hay. They can, when they're younger, they can have alfalfa. When rabbits are younger than 5 months, alfalfa has increased protein and increased sugars in it, so it's more than most rabbits need, but Timothy hay is needed daily. If they don't get it daily, they could have some serious issues. Which pet requires a daily dose of fresh vitamin C? Now, I said this earlier, and if you'll remember, it's a guinea pig. Guinea pig needs fresh vitamin C. Now, you can get doses of vitamin C over the counter in most pet stores, but you have to look at the date because vitamin C in a bottle goes bad very quickly. Vitamin C in a fresh piece of fruit does not go bad. So using fresh fruit or vegetables with high vitamin C can be very helpful. If you have any questions, I know this is a lot of information. Please go through it again. Make sure you understand the different components that make up a good nutrition, good balanced diet for our pets.